So hi, I'm Swarup Swaminathan. I am an associate professor of ophthalmology at Bascom Palmer Eye Institute at University of Miami, and I am a glaucoma specialist and love using Spectralis to care for my patients. It's super helpful. The fact that when a patient is scanned multiple times, the fact that the patient's axis between their fovea and their optic nerve head is really maintained and is stable between scans is really helpful. It allows me to trust my scans as I get them over time. And it really provides the confidence that if there is a change, that it's probably real. And the GMPE is a really useful piece of software because it not only allows me to look at the optic nerve head, but it allows me to query the macula with a lot of detail. It allows me to evaluate for arcuate-like changes, which would be suspicious for progression in glaucoma using the macula scans. And so, glaucoma progression with OCT is kind of like a detective work. You're trying to use one set of scans to kind of be like, I think there might be something going on, and then use other images to kind of help prove that hypothesis. I guess you can think of it that way. So the fact that there's nice complementary scans that have very consistent data from time to time for a patient really gives me the confidence in believing the output. So what I love most about the Spectralis, I think, is the fact that I get all the data and I can view the data the way that I want it to. I think a lot of other platforms kind of give you data in a specific way and that's about it. But Spectralis and HiEx give you the opportunity to interact with the data in the way that you want and to the degree that you want. And that's, I think, really, really helpful. In clinic last week with my fellows, they really enjoyed learning using HiEx, and we were looking at some segmentation and maybe where there were some challenges in segmentation and how we could fix that if we needed to. And I think it's just really, really powerful that you can kind of interact with the data in a way that is good for you clinically, and if you have trainees in your program that you can teach with. And it just is a really wonderful way to understand a patient's trajectory.